We now turn to Governor Greg Abbott, who is announcing his plans to reopen Texas businesses. Let's listen in.
Tragically lost their lives. Economic damage has hit even more Americans than the coronavirus itself. More than 22 million Americans have filed for unemployment. More than 1 million Texans have filed unemployment claims. Businesses have shuttered. Paychecks have disappeared. Food bank lines are swelling across Texas as more families seek food that they desperately need. Well, in typical Texas fashion, you have come together to support one another. You have made personal sacrifices to ensure that our state slows the spread of COVID-19. You helped to reduce the number of Texans who needed hospital care. You truly helped to save lives. Now, Texas needs you to continue those efforts. But I want you to know that we are especially grateful for the doctors, the nurses, the first responders, and all medical personnel who have been battling on the front line against this invisible enemy. We're also thankful to the unsung heroes serving as childcare staff, grocery clerks, food service providers, and the folks who clean our hospitals. And we're grateful for President Trump, Vice President Pence, and the entire Trump administration for being available to me and my fellow governors 24/7 throughout this entire pandemic. I also want to recognize the members of the Texas House and Texas Senate for their ongoing leadership in their districts. And I want to recognize all of our local leaders for their continued partnership as we collectively respond to the coronavirus in Texas. Because of the efforts by everyone to slow the spread, we're now beginning to see glimmers that the worst of COVID-19 may soon be behind us. The number of infections and hospitalizations is beginning to level off. We have a steady supply of PPE like face masks. We have plenty of hospital rooms and ventilators to treat our fellow Texans. And the deaths, while far too high, will not come close to the early dire predictions. And I'll add this. Texas has the second most recoveries from COVID-19 of all states in America. We have demonstrated that we can corral the coronavirus. We continue increasing our testing capabilities to help us identify and care for Texans who have COVID-19. New strategies are being used by private businesses and the public sector to contain the coronavirus. Things like checking temperature, distancing practices, and better sanitation standards. We've shown that we can both continue our efforts to contain the coronavirus while also adopting safe standards that will allow us to begin the process of reopening business in Texas. So today I'm issuing an executive order that outlines how we go about opening the Texas economy, helping you return to work using the safest standards to contain the coronavirus. Now, in opening Texas, we must be guided by data and by doctors. We must put health and safety first. We must prioritize protecting our most vulnerable populations. We will be getting input from medical professionals as well as business and community leaders to determine the safe and sure way to reopen business in Texas without spurring the spread of the coronavirus. To guide this effort, I have formed a statewide strike force to open Texas. The team includes Lieutenant Governor Dan Patrick, Speaker of the House Dennis Bonnen, Attorney General Kim Paxton, and Comptroller Glenn Hager. They are joined by a team of nationally recognized medical advisors who will inform us about the best healthcare standards to prevent the spread of COVID-19. Those advisors include the Commissioner for State Health Services, Dr. John Hellerstedt. They also include Dr. Mark McClellan. He served both as FDA Commissioner and Medicaid and Medicare Administrator for the United States of America. It also includes an infectious disease specialist and Director of Testing and Tracing of COVID-19 at the University of Texas Dell Medical School, Dr. Parker Hudson. And they include Dr. John Zerwas, the Executive Vice Chancellor for Health Affairs at the University of Texas System. They will work together to develop a medical architecture to comprehensively test and trace COVID-19 that will enable Texas to gradually and safely begin the process of returning to work and returning to other activities while we wait for the immunizations that will end the threat of COVID-19. Our medical team will work with an advisory committee of successful business and community leaders who will share information and innovative ideas to help businesses strategically reopen while also containing the spread of the coronavirus. They include entrepreneurs like Kendra Scott and Mattress Mac Jim McInville, world-renowned tech leaders like Michael Dell and Robert Smith, economic development leaders like Ross Perot and Bob Rowland, small business leaders like Arcelia Acosta and Massey Villarreal, economic experts like Richard Fisher, the former president and CEO of the Federal Reserve in Dallas, dining and entertainment trailblazers like Tillman Fertitta and Ballas Miller of Bill Miller's Restaurants in San Antonio, Texas. Nonprofit organizations, leaders like Nancy Kinder and Kirk Watson, the founding dean of the University of Houston Hobby School of Public Affairs. This team will collaborate with working groups to open up Texas while keeping our communities safe. They will be led by a chairman who has successfully run businesses and knows his way around the Capitol, James Huffines. He will preside over a full-time staff spearheaded by Mike Toomey, a proven chief operating officer who knows how to quickly deliver results. I want you to know that I've already begun working with this team about next steps for Texas. James Huffines and the full-time staff have been working around the clock, and the team of advisors has already finished their first meeting, and they have begun the process of making recommendations. As a result of our combined efforts, I am issuing executive orders today that will begin the process of opening Texas. Now understand this. Opening Texas must occur in stages. Obviously, not all businesses can open all at once on May the 1st. Some businesses, if fully open without better distancing standards, would be more likely to set us back rather than to propel us forward. A more strategic approach is required to ensure that we don't reopen only to have to shut down once again. First, will be openings announced today that include activities that should pose minimal or no threat to expanding COVID-19. Second, additional openings will be announced on April the 27th after further input from the advisors and the medical staff. Third, even more openings will be announced in May when it is determined that the infection rate continues to decline, that hospital capacity remains available, and when testing capacities are sufficient to detect and contain outbreaks of COVID-19. The first executive order today establishes the governor's strike force to open Texas. It sets out the organization and the duties of the strike force. They will gather information and make recommendations about ways that businesses can reopen, as well as the safe practices those businesses should use.